I have a little bit of an introduction to make. So rather than waiting, I will use that time to kind of make that introduction. So I have a little bit of flexibility to make that. Today we have Haim Yacobi as our Monday night speaker. So for those who do not know me, I'm Nihal Barat, the chair of the Department of Urban Planning. So we are very glad to kind of have Haim. He's an architect who specializes in critical urban studies and urban health. His academic work focuses on post-colonial architecture planning and development in Israel/Palestine, the Middle East and Africa. His research is interdisciplinary, so uses frameworks from different disciplines and cuts across many fields, including development, urban studies, and geography. Spatial justice and urban health. Spatial justice and urban health, contested urbanism, transnational migration, and informality are the core of his research and consultancy. So he's also involved in urban health. Health is an important aspect of urban development. His approach to urban health is based on understanding how history, power, and structural inequalities interact to produce urban health disparities. Right? It's not just descriptive, but very analytical. He believes the study of urban health and the development of interventions in any urban context should look at the effect of urbanization on both physical and mental health, and consider the role of urban forms and policies as foundational causes of racial and ethnic inequalities in health. Right? So health, he doesn't look at health as equally distributed. His work has been published in leading international journals, in monographs, and he's done several edited books. I was fortunate to get a copy of one of his books called Israel and Africa, a genealogy of monogeography. So you can see his focus here. He's the co-founder of DIMCOM, Planners for Planning Rights. That's an NGO that deals with human rights and planning in Israel. He was a Fulbright. He actually works with. This is the focus here. My connection, comes through his work with the Bedouins, who are a minority group in Israel. And he was a Fulbright postdoctoral fellow at the Center for Middle Eastern Studies at the University of California at Berkeley. He received a Marie Curie grant that enabled him to work at Cambridge University, so all the great universities also, where he led a research project dealing with contested cities shaped by ethno-national conflicts. Finally, I also figured out that we both have studied at the same place, same university, University College, and he actually now teaches them. He became professor of development planning at the University College of London, and it's great to have him. You can take over. Thank you very
much. Can you hear me? Yes, I think you can. Thank you very much, Nihal, for the introduction and for invitation. Sorry?
Do you want the lights down for that?
Just a bit, so people will not fall asleep. So thank you very much for the introduction and the very generous invitation. So far it was a very, very nice way to meet new colleagues and some students here. So thank you very much. What I would like to do today is to discuss my previous work with some work which is in progress. I prepared it especially for you guys, so it's also a good opportunity for me to have some feedback from you, questions, critique, and I'll be very happy for a discussion at the end of my presentation. I will start with reading because I want to be very accurate, but later I will speak without my text, so it won't be that terrible. In 2005, a petition was filed to the Israeli Supreme Court of Justice by the Association for Civil Rights in Israel and Physicians for Human Rights, an NGO that deals with health and human rights, on behalf of Inas El-Atrash. Inas was a 3-year-old girl, lived in an unrecognized Bedouin village, and was diagnosed with aggressive cancer in her chest. After sessions of chemotherapy and surgery for the partial removal of the tumor, Inas needed constant antibiotic treatment and injection to strengthen her immune system. Medicines that needed to be kept in temperature of 0 to 4 Celsius. Since the treatments weakened her immune system, keeping hygienic, air-conditioned environment was essential for her recovery, especially in the hot summer days in the Negev desert. The appeal to the Supreme Court filed against the Minister of Health, Minister of National Infrastructures, and the Minister of Interior demanded her house should be connected to electricity in order to provide her with proper care. The petitioners emphasized that the state, in refusing to connect the girl's home to electricity, violated its commitment to protect children and to place the welfare of the child above bureaucratic, land, and ideological considerations. The Supreme Court rejected the appeal and accepted the state proposal to provide about $3,000 for purchasing fuel for a generator which belongs to the neighbors and also services the residents of Inas' family. Not before, the judge themselves stated that this solution is far from adequate. However, the judges did not obligate the state to connect the home to electricity, claiming that the parents of Inas choose to live in unrecognized village, and I quote, knowing that they would therefore not be able to connect to basic infrastructure. However, they choose to ignore the claims of the petitioners that the child's right to life overpowers the planning and bureaucratic considerations, and instead choose to declare their, and I quote, hope and prayer that Inas will recover and again be fit. The court recommended the family, and this is important, to move from their unrecognized village to a planned formal settlement and counted the amount of financial assistance several organizations offered to the family to finance a generator. Due to this decision, Inas was forced to continue to face her illness and slow recovery process on her own without a proper air conditioning system, which the state could have provided in order to aid her immune system in handling the dangers she must confront. Of course, given that the appeal was close to the winter months, this decision also meant that the home was not be properly heated. As I would suggest, the case of Inas clearly illustrates the way in which health, as a basic right, and space are entangled. Electricity, clear water, sewage system, and adequate housing conditions are basic conditions not just for ensuring healthier environment, but also for the provision of health care. Yet, I would argue that in the context of settler colonialism, where territorial and demographic control are prioritized over basic rights such as health, these are limited. So today, what I would like to do is to understand, and I must say that I don't have any clear answers to these questions. What I'm interested in is, through the story of Inas, to understand how and why space is political, and whether non-planning is a policy rather than abandonment or withdrawal of the state. Can we understand informality as a form of political protest? And finally, what is our role as planners, architects, and urban designers in working with vulnerable communities on health planning issues? So there are several arguments that I would like to emphasize. The first is that political context, such as settler societies, this is the framework through which I see Israel in political and spatial terms. So settler societies have a significant impact on how space is organized. And here I would like to emphasize that I'm working on top-down policies and planning, but also on the way in which people use space and claim space. The second argument is that the organization of space, planning, non-planning, and spatial protest affects the right to health of the communities residing in that space, and I think this is quite obvious. Finally, almost all rights, as well as all key principles of the new urban agenda, have some sort of spatial dimension, and it is not that human rights are in some sense spatial, but that the way space is unplanned or planned, controlled, organized, it affects the protection, violation of human rights in fundamental ways. So just to give you some kind of background, the new urban agenda sets some principles which are very relevant in my view. First of all, that in every urban context one should provide basic services for all citizens to ensure that citizens have access to equal opportunities. Access is a very spatial element. To promote measures that support cleaner environments, this is obvious. Strengthen resilience in cities to reduce the risk and the impact of disasters. To take actions to address climate change. Fully respect the rights of refugees, migrants, and internally displaced persons. This is very important to our case. To improve connectivity and to promote safe, accessible, and green public spaces. So I think you can understand how these elements are spatial. And the idea is to have progress in health that will depend not only on the strengthening of the health system, which is obvious, and that's what people from public health will argue, but also on shaping healthier environments. And I think this is, the perspective through which we, planners, architects, urban designers, should look at the connection between health and space. But, as a bad boy, I was doing critical work. I think it's important also to put these very nice ideas into more critical understanding of power relations. So, on one hand, we can see a very interesting and important growing literature on planning and health. I think the work of Jeremy Corbyn is very, very important because the questions that he's asking, for example, how can we return to health and social justice roots? Because health and planning as disciplines, they are developing, in parallel, and they are very much linked to each other. What are the connections between planning and health equity? What new political processes can help to connect planning and public health with a focus of addressing the social determinants of health? I will say a few words later maybe on social determinants of health. While on the other hand, we have a very important growing literature on the global south and post-colonial urbanism that enables us to question such an interesting and important approach that Corbyn poses. So there is kind of assumption that we live in a liberal society, that if we will work hard politically in a collective way, we can change the world. This is a very important idea which is not relevant to many of the cities, I would say, which are not in the global north, if you want. And I think that it was Libby Porter who put things in a very straightforward manner, and I would like to read her argument. What remains absent from current critical theory is recognition of the colonial culture roots of planning epistemological and ontological position. To grapple this fully would require accepting that very objective values, processes, and knowledge that constitute the daily practices of state-based planning are themselves complicit with the ongoing colonial domination of place. So I think Libby Porter puts a very important argument that is very relevant to my discussion today. And a few words about settler colonialism. I guess that, for most people in this room, they know something about it. But what is very important to understand that settler colonialism is a social, political, and territorial project in which, in the classical cases, white people settle in a kind of terra nullius, appropriating land, manpower, etc., and creating ethnic or racial hierarchies. And what, my work is very much based on the work of Professor Oren Iftachel, who was also my supervisor, who puts Israel in this framework. I know that, for many people it's a very uncomfortable framework, but I think that this is a very important way to understand the way in which Israeli territory was shaped and how Israeli society is shaped, because we have a clear hierarchy that has to do with ethnic belonging. If you are an Ashkenazi Jew who is coming from East Europe, you are more privileged than Mizrahi Jews, Oriental Jews, and of course, at the bottom of this hierarchy, you have the Arab citizens of Israel, that the Bedouins are part of them. Arab citizens of Israel are those who were in Israel when the state was established in 1948 and remained in the space, in the territory. And just to give you a good idea about how it looks like. So here you have a map that shows the Israeli territory in general. The green line, the occupied territories are on the right. Israel within the green line is on the left, where you can see many of the red dots. And you can see on your right hand the Israeli settlements in the West Bank and the Palestinian, this is the green color, in the West Bank. While on the left, on the western part, you can see Israeli settlements, cities, villages, etc., etc. But have a look for a moment on the southern part of Israel that I will focus on. Here you can see this yellowish amoebas, if you want, which are the Bedouin settlements, most of them unrecognized settlements. But what is important for me to say here, that the Bedouin settlements are unrecognized settlements by the state, because through the project of settling in Israel, Bedouin land was expropriated and used and transformed into a state land, while the idea was not to plan any Bedouin settlements with the hope or fantasy or illusion that they will disappear. But of course they didn't disappear. In fact, they are still there, and I'll show you some images. What is very important, that the land dispute is very, very strong. The whole conflict between the Bedouins and the state is about land. And this was very much the focus also of the research in the last 15, 20 years. I would like to refer, and I will not be able to develop it further today, to the way in which the Bedouin settles in the south of Israel as a way of spatial protest. And spatial protest for me is social conflict is expressed through analyzing the conceived space, the perceived space, and the lived space. And I aim to rephrase the act of resistance and to stress the role of spatial protest as an alternative pattern of opposition vis-a-vis the control mechanisms implemented by the state. So I see it as a political project of developing informal settlements in the south of Israel. Spatial protest, and this is important, is characterized by autonomous initiatives reflecting personal and social needs that challenge the interests of those in power. So the struggle between the state and the Bedouins around the land, we cannot approach the Bedouins as being passive. The project of settling informally is part of their resistance. And here you can see two images of how part of these settlements look like, okay? So I want to go back and ask what is our role as architects and planners, in such a complex situation? Are we doing advocacy planning? Are we approaching it through radical planning? Can we start discussing decolonizing planning education in this situation? So I think that, there are some images here that, of projects that I was involved. The first one is with BIMCOM, Planners for Planning Rights. This is an alternative master plan that was prepared with the participation of the Bedouins in order to find a solution that the state will recognize some of these villages. Nothing actually happened. Some villages were recognized in the last few years. I will speak about it a bit later. I was trying when I was teaching in Israel to bring students to know this community, to understand that these people, they claim their land and they are not criminals. But first of all, we must understand their work or their behavior as a way of resistance. And of course, we also developed some work with communities, which I find very important. But it is important also to have a closer look at the southern part of Israel. And we cannot go into the details, but what is very important, all the red dots are unrecognized villages. So this is something that can give you, I think, some idea about the scope of this phenomena. And it is important, you have a black dot there. This is Beersheba, the main city, that many of the Bedouins, they use it. They use the hospital, for example. They use it for shopping, etc., etc. So the whole separation between urban, rural, as we discussed today, is very questionable. I think it's better to look at it as a metropolitan, where different settlements exist and different relationships with the main city exist. But this is maybe my opinion. I don't think many people share it with me. So far, I try to give you, the context in which the unrecognized informal settlements are established and what kind of political tension exists in the very existence of these settlements. But in the last year or so, I started to be interested in the relationship between these processes and questions of health. And there are two reasons for that. The first reason is that, as I told you at the beginning, there is a clear connection between space and health. But from a more political perspective, or as an activist actually, I started to believe that if we want to create some change, maybe we cannot discuss land disputes anymore as a basis for a struggle. Maybe we should start discuss health and what is the effect of this situation on the health of the Bedouin society. So I did a very simple exercise. Here you can see 3 settlements. Omer is the richest suburb, one of the richest suburbs in Israel. On the spectrum, I don't know if you can read it, but economically speaking, it is in the top of the socioeconomic rank in Israel. It is a Jewish suburb, and 3 kilometers from Omer is Tel Sheva. Tel Sheva is the first planned town that was planned for the Bedouins at the beginning of the 70s. The idea was to try and to push the Bedouins into planned towns and to expropriate land. I don't want to discuss it into details, but this is one of the biggest failures of planning in Israel. Because these towns, beyond the land issue and the idea to control the population, they were planned without any connection to the cultural, social needs of the Bedouins. And Tel Sheva is one of the poorest municipalities in Israel, only 3 kilometers from Omer. 4 kilometers from Omer, a bit to the north, you can see Batin. Batin is an unrecognized village that was recognized by the state. And being recognized by the state means that the state can start providing infrastructure, electricity, sewage, water, clinics, etc., schools, etc., etc. So what I find fascinating is that, such a short distance between these three settlements, and you can see life expectancy of men in Tel Sheva, 76, in Omer, 81. You can see it also with women, 81 and 84.5. Mortality is higher in the Bedouin sector, and so we can see that in the very immediate data that we have, that there are like such a short distance, such a big gaps between the different communities. So I think it's important to start to understand how planning, space, and health are linked to each other vis-a-vis recognition, unrecognition, planning, and non-planning. So let's have a look at the issue of environmental hazards. That part of the informal settlements, next to them, for example, you can see this is an industrial zone which is very close to one of the unrecognized villages, Wadi el-Nam. And it's very interesting to see that the industrial zone of Ramat Chovav contains about 20 chemical industry facilities. The minimal safety radius around such plant is 5 kilometers, while the unrecognized village of Wadi el-Nam is located only 1 kilometer. So epidemiological research examined whether mortality in the Bedouin population in this area is associated with the residential distance from Ramat Chovav. So we can see that there is increased mortality rates due to symptoms and the conditions of non-external causes were observed in the Bedouin population, in both men and women. For example, dozens of Bedouin babies are suffering from congenital malformations who live next to this industrial zone. Also, malformation among Bedouin residents living near Ramat Chovav is twice than those who live more further. So obviously there are higher rates of respiratory disease such as asthma for people, people are Bedouins who live next to Ramat Chovav. So you can see that planning the industrial zone so close to the unrecognized village affect, of course, the health of the people who live there. But don't forget that this village does not exist on the formal maps of Israel. So you can do whatever you want. You can plan whatever you want next to this village. Another issue, something disappeared in the image, but has to do, of course, which also has to do with environmental injustice, the lack of waste disposals, which creates many, many problems and, of course, affects very much health issues in the unrecognized villages. And what is also important, and you can see how housing demolition, because one of the mechanisms that the state uses in order to perform power in these unrecognized villages are housing demolition. They demolish houses that are built by the Bedouins in order to stop the informal process of producing settlements. So obviously, the remains for themselves are the cause of different accidents in these villages. Another example is, of course, the sewage system and the fact that some of the villages are very next to a sewage stream that comes from Hebron, from the Palestinian Authority area, that goes down because environmental hazards have no borders. It starts in the Palestinian part, it comes to the Israeli part, and all the people who live along this valley suffer from it. But this photograph this photograph, unfortunately you cannot smell it, but it's really, it crossed an unrecognized village. And I saw with my eyes moms and children crossing the water from one side to another. And so I don't have to tell you, what is the meaning of it from health perspective. And of course, the issue of water, which is, I mentioned it. I mean, water is a basic element, or that one would expect to have these days. So you can see that in that picture, that only following a very extensive legal struggle, water supply in the recognized villages, those that were recognized, the state must provide water. So water supply in the recognized villages is often provided by water centers. What are water centers? You see this building here. People have pipes linked to the main source of water. You can imagine in 40 degrees in the summer, what is the quality of the water, drinking water, that people have. So in 2010, Physicians for Human Rights submitted a request to the government's finance committee to order the establishment of 10 more such water centers, not just to the recognized villages, but also to the unrecognized villages. So obviously, it didn't happen, because if it's a recognized village, the state has no commitment to do anything. And of course, you can see also another solution for water, a more prevailing way of bringing water to villages is plastic or metal tanks. So again, you can imagine what is the quality of the water after staying in the sun, for a long time. And it has, especially the issue of water has an immediate impact on health issues among the Bedouins who live in the villages. And electricity. So it's nice because some of the Bedouin family managed to find solar solutions, but the state sometimes demolish it because they are not allowed to build any elements, if it's an unrecognized village. But electricity, as I've told you about the case of Inas, of this 3-year-old girl, without electricity, you cannot keep medicines. I'm not talking about having lights or warming the house during winter. In the desert, it's very cold during the winter, especially in the night. So without electricity, you cannot protect some of the very basic rights. So electricity is not provided in both recognized and unrecognized villages, and people use generators, which makes the production of electricity is much more expensive. So the poorest community pays the highest price for electricity because of unrecognition, and even if the village is recognized, as I told you, there's no electricity. And you can have a look, for example, that in this village, you can see that there is a very significant electricity infrastructure very close to the village. So, of course, it's not very healthy to the people who live there. But more than that, it's very easy to link them to electricity system. But of course, they don't do it because it's what you see here is not, it doesn't exist in the maps of the Israeli state. So, of course, the lack of electricity has major effect on the health of chronic patients. They cannot keep their medicines, for example. Those who have respiratory disease, they suffer because they don't have electricity. And, of course, those who don't get, medicines, because even in the clinics, as you can see here, in the state was forced to have clinics. I think in English you say surgery also, but clinics that will serve the people in the unrecognized villages. So following a very legal struggle, the state was forced to do so. But if you don't have electricity and you have a generator, what kind of services you can give as a clinic to the population? So obviously, most of these clinics, they work on generators. Some of them are doing amazing work, I have to admit. I visited some of them. I spoke to the staff there. They're doing amazing work within the limitations. But they cannot provide everything because of the fact that they are not linked to any infrastructure. One of the results of living in an informal environment is home accidents. I was quite shocked to discover that there are high rates of hospitalization of Bedouin children due to home accidents. The most frequent accident type register was burns. In many of these huts, people cook on open fire. And it caused, of course, many accidents. And I was shocked. I visited in one of the schools, and the director of the school really told me about many children who cannot come to school after an accident. So you can see that the very basic environment that they have in the informal settlements also causes a problem. And children are the most vulnerable group in this society. You can see a bus and a child, no roads, no infrastructure, so it's quite obvious that the potential for accident is quite high. But since we're talking about a society which has lots of children, I think it's very important to look at the numbers. So, for example, mortality rates are extremely high within the Bedouin society. In 2006, infant mortality in the Bedouin population was almost 3 times higher than the average Israeli. And even within the Arab society in Israel, the mortality rate within the Bedouin society is higher than the general Arab society. And the reasons are, there are many reasons. Malnutrition is one of them, but also one of the problems is marriage within the family, and some other issues that has to do with, like food security affects very much children's growth and health. So what is very important for me, in order to wrap this discussion, what is important to me to say is that settler colonialism involves, as historically we know, forceful appropriation, legislation, and different apparatuses of control. The specific case of the Bedouin space in the Negev demonstrates the link between non-planning, unrecognition, spatial protest, and health, pointing on the necessity to take into account not just physical and economic determinants such as poverty, poor nutrition, inadequate and unsafe housing, but also the political aspects that created them. And this is, my kind of critique towards the literature on planning and health, that they assume that we all live in a kind of a liberal society and not in a context that ethnic hierarchies is very basic for the distribution of goods, for example. And it is very important to see that beyond genetics and the distribution of health services that are very often seen as primary causes of health disparities, I can conclude that the production of space in the context of settler colonialism is the main causes of it. Access to water, electricity, services, or proximity to environmental hazards are indeed not neutral facts, but rather a result of policy and planning. So for me, non-planning is a policy, okay? Unrecognition is a policy. It's not a passive, neutral, behavior. It's a very active understanding of how we are going to engineer territory. But since the right to health is spatial, as you could see, the settlement project of appropriating, controlling, and ordering space is crucial in understanding the institutional foundations that produce health disparities. We cannot, even as planners or as health experts, we cannot develop, in my view, intervention, just, a kind of neutral intervention in space without understanding the very political conditions that created the specific health disparities. But informal settlements cannot be viewed also as external to the planning system, and thus also health disparities. In certain societies, the links between planning and health, territory and the body, are not solely the results of policy, but rather are inherent to the control and exclusion mechanisms towards the ultimate other. So I think that from a theoretical perspective, we should start to understand that in certain colonialism context, certain colonial context, it's not just territory, it's also the body, which is a subject of control. In the global south, planning can be determinantal to health in both formal and informal settings and act to prevent disease and reduce health and safety risks. Yet in Israel, space is organized in ways that help to protect rights, not so much due to planning regulations or policies, but rather due to the economic, social, and cultural capital of a given community. Hence, planning that in principle, and I know that it sounds like a very modernist approach to planning, but planning in principle can help secure human rights in general and health in particular, and conversely, a non-planning policy endangers human wrongs, as in the case of the unrecognized villages. Thank you.
Thank you very much, Haim. Thank you for bringing people into planning. And also, I can relate to something that's going on in India, where the colonials were blaming so-called tribal communities for their children dying at a younger age because of this half-sickle disease. And then it was interesting, one of the activists kind of told, because from a science standpoint, half-sickle disease, the hemoglobin has, half hemoglobins, cells. So this comes from the parents. So any doctor would say, this is the parents' fault, right? And so on. Then you figured out all these tribal groups in India spread out they are not even that related. This cannot be genetic. It comes out of malnutrition that happened in the colonial people. So it's quite interesting to kind of see, some things that when we analyze within a small framework, we have one answer, but we believe that to be true. But when you look at the larger pictures, it's totally something else. Yeah. So thanks very much. I will open it up to the floor. For any questions, comments, commendations.
I'll break it down. First of all, thank you again. I would be honored to travel over to London and make a presentation. And what I will do is I'd borrow your show and just change a few words here and there and change some background images, and I will be describing the United States in great detail, maybe even more discouraging. As it relates to health, as it relates to otherness, as it relates to environmental justice issues, as it relates to even being unrecognized, being invisible, having lack of access to about these structural systems, is it possible that, I'm curious if there are disadvantages to recognition, and if so, what could they be? Are there ills to, are there a price to pay to be recognized?
So, I mean, I really like your question. And I'll tell you why. Because I tend to think that recognition is not a solution. Just a minute, I want to share, I'll show you. Because I cannot show all the data I have, but what is very interesting to see is that the differences between, planned cities, Bedouin cities, and recognized villages, and the health disparities, you will not be healthier if you will live in a planned city, if you're a Bedouin. So recognition also means more control, okay? Because if we recognize you, you have to behave nicely. And then it also means that you cannot demand more land, because the deal with it is the deal. So I agree with you. I think the struggle, I can understand, the tactical motivation to focus on land, because land is an issue, and this is the issue. But I think that, to some extent, the real struggle is about, the contents, the meaning of being an unequal citizen, and I'm not so sure that recognition also leads to better life. We can see, most of the images that you see, I've showed you today, are from, this switch, it goes along a recognized village. So nothing dramatic has been changed. I think when you live in a recognized village, you're more under control. Building illegally will be more problematic than building illegally in an unrecognized village, because you're under the radar of the state. Yeah, but I totally agree. I think, this is maybe an extreme case, but we can see it in all our cities, globally.
Well, I want to go to London too.
Okay, you're very welcome, guys.
There are no conditions, really, for me. Let me ask you a question, and I have 2 points to make. Do you have something like the 14th Amendment in the Israeli Constitution? Equal protection under the law.
In Israel, there's no constitution,
Oh, really? Okay.
And it's a very delicate issue.
And of course, we do have it.
I know.
But it doesn't mean a damn thing.
Yeah. Yeah.
Well, sometimes it means something if it's before the law. We're not getting into a little bit of damn thing there either. The 2 points.
Yeah.
One is absent land development regulations, planning, and LDOs. You're regulated by health and safety, at least you are in the United States.
Mm-hmm.
So we have certain counties in the state that have neither zoning or subdivision controls, but they are regulated by health and safety in terms of the county health department, which is authorized by state statute for that. So they can close down operations if there is a hazard.
Yeah.
Environmental or public health type hazard. I don't know if you have the same thing in Israel. The second is we have a rich tradition in the United States that land ownership returns citizenship and suffering. We have the freeholder concept in colonial times that crept over into the United States. And then we had a board chosen by freeholders. So the only people that could vote were people that owned land free and clear of any encumbrance on the land, like mortgage and so on. So we even narrowed it down to forget about a deed, you have to own it free and clear or something like that. So we even have homeowners associations where the only people that can vote are people that own land. So if you're a tenant in that particular district, you have no franchise whatsoever. And so the list goes on, the tradition continues. Of course, with the 14th Amendment, we don't recognize ownership. We just recognize human beings. So I guess my point is, on the second point, there's a political
And so land ownership is at the basis of that suffrage movement. So if you don't recognize that they own land, there's non-ownership involved, you don't get the right.
So it's not the case because the Bedouin, I mean, I think it's a bit more complex here because they are citizens. They have the same idea as I have. But the state does not recognize their ownership on the land. The reason is historical, because during the Ottoman and later the Mandate period, they didn't register under the Mandate regime. And now the state has a case to say, it was not registered, so it means that it wasn't yours. So these days, all these issues are in the High Court, and many scholars are doing their career out of the legal understanding of land ownership. But if land ownership is not accepted by the state, the very presence of these people on the land also is not accepted. So, they are visible. You're right. I mean, this kind of visibility is is basic for the unrecognition.
But you have a parliamentary government, so it's dependent on location.
Yeah.
So if you don't own land at that location, how do you have the franchise to go through?
So, you see, there's this link between their citizenship and the land ownership. Because in Israel, anyway, most of the land is owned by the state. It's a state. In Israel, 97% of the land is owned by the state. 97%. Yeah. So this is an amazing phenomena. So mainly, the Bedouin society and the Arabs in the Galilee, they own the land that was remained in their hands. But still, you can see that it is under dispute. So in Israel, you don't have this connection between land ownership and citizenship.
You.
Because in my understanding of the communities in China, policy policies are never full. Like maybe like even here I can see this landscape and the constitution is always working going in the court because there is a judge, there are lawyers, we argue, maybe in the law. I mean they're all subjective. So what I see is the connections between this division. So you also mentioned about the ontology difference. So I was just wondering, does this division really works? Does the policy really formally imply in the field?
I think it's a wonderful comment and question. I think that the distinction. I think informality will not disappear, and that's what I was also trying to say. That informality is part. Is not out of the system. It's part of the system. Okay, and I think it will stay like that, even if the state of Israel will recognize, all the villages. I also think that if you want to understand, some of these informal settlements, they have a very clear logic, spatial logic, of the way in which they are produced, which we should learn and understand it rather than objective and demolish it. This is another issue. And, I think, I agree with you. I think the problem is not always with the explicit regulations, law, etc., etc. Sometimes it's more important to understand the implicit policies, the way in which they shape space. Because, of course, if you go to the Ministry of Interiors and you'll say, hi guys, what you're doing here is, is terrible, blah, blah, blah. They will not tell you, we have a clear policy to ignore these villages. They'll tell you, look, we look at the map ownership, the ownership maps of Israel. This is, a state land. It's not, this land is not a private land of anyone. And then you start digging, in the archives in order to understand how happened that their land became state land. So there's a whole legal structure that protects the state's ideology. So it's not just planning. We should understand, how planning and legal structure work together. So, yeah, I don't think that I don't think that informality will disappear the day that the state of Israel will recognize all these villages. I think, for informality there are many reasons: political, economic, cultural, etc., etc.
So we are running out of time. Maybe any quick questions?
Your passion is contagious, so thank you for sharing it with us. And how did you get interested in it?
Sorry?
How did you get interested?
It goes back when I was studying at the DPU, where I'm now a professor. When I was studying, I wrote my dissertation on one of the planned town, Bedouin towns. I analyzed these are planned towns, but the Bedouins, they built illegally. They built against their planning regulations. And I was very curious to understand the tension between the way in which planners plan the city and the way in which people use it. And, then, I did some field work, and then, I went into this world. So, yeah, it tends to the same place that we're coming from. Yeah.
Last question.
As far as I know, and by definition, Bedouins are people who are moving from place to place, and they don't have permanent shelters or houses. So it seems to me from the photos and from the things that you described that they are starting to build development clusters. So are the densities in those cities are stable and they are growing? And if it is, why they are still calling them Bedouins? And if it's not, how that will add to the problem? Because if they are not living at the same place and they are moving from time to time, how the government will be able to provide them with electricity or healthcare or other services?
So I'll try to be as short as I can, but it's, first of all, the Bedouin society has been changed in the last 100 years. when we say nomadic, at least the Bedouins in this area, they always had, like a place where they live, and nomadism had to do, with agriculture, with seasons, but there was always an address, if you want. So the idea of nomadism as kind of, like we see in American films, it's not the same. And especially after the establishment of the State of Israel, when most of the land of these Bedouins was expropriated by the state, they understood that they have to stick to their land if they want to keep it there, for themselves. And of course, also the proximity of the villages to cities that offer jobs, services, change the economy, change the culture. I mean, it's a society which is in a transition. So I think most of my Bedouin colleagues and friends don't want to be understood as nomadics, like riding camels in the desert, not at all. So this is very important to say. And I think that, it's very interesting how politics of identity is related to it, because when I started, in the mid-90s, the people I interviewed for my research used to define themselves as Bedouins or Israeli Bedouins. Today, some of them identify with it. They would say, I'm an Arab Palestinian Bedouin. So they identify themselves with, Palestinian people. We can argue yes or no, but this is the way they identify themselves, as Arab Palestinian Bedouins. And I think it is very telling if you want to understand the relationship between the Bedouins and the Israeli state. Because I think the conflict also produced a different identity. I don't know what it means, but this is a kind of observation.
Well, I hope you all enjoyed. Thank you very much for coming.
Thank you.
very, very
How it?
Thank you.